Uh, oh, there we go. Okay, we are recording. Got it. I'm Dr. Janaea Wood. I'm a naturopathic physician with Tummy Temple, primarily based out of Lacey and Olympia area. Although, both of us do see people remotely. And hormones are a major area that we focus on at Tummy Temple. They play a huge role in all aspects of our health and interact with so many other things. I also specialize in complex chronic illness, mold illness, autoimmune diseases, eczema, to name a few. So those are some of my other areas of emphasis. And just want to say, you don't have to save questions till the end. Just you can unmute yourself and ask if a question occurs to you along the way, or you can type them in the chat and we'll try to, notice those and answer them as we go. Dr. Dowdy, do you want to introduce yourself?
Sure. Welcome, everybody. I am also a naturopathic physician and the medical director of the Tummy Temple Clinics. I work alongside Dr. Wood. She's my lovely colleague, and we support all types of patients, a lot of detox focus, gastrointestinal health, and hormone balancing, because as she mentioned, that is instrumental in just building a foundation of health and optimally aging. So thank you all for being here.
Just wanted to say thank you so much, Monica, and thank you to the co-op. We really appreciate that part of your mission and just you in general. I buy a lot of my groceries there and appreciate all your care and attention with feeding us good quality food, which is important for hormone balance. So anyway,
totally. Yes. So let's talk about menopause. First off, menopause is not a disease, a diagnosis, or a disorder, right? This is a transition that all women and people with ovaries are going to go through at some point in their life. And what's happening biologically is our ovarian egg productions and hormone production starts to decline in the amount of estrogen it produces, progesterone, and commonly testosterone levels. So there's this time, this phase in life, and it can happen as early as someone's mid 40s and can even extend into the mid 50s. Some women experience perimenopause and the full transition to menopause over the course of 7 to 10 years. And most commonly, that is initiated by the 40th decade. So technically, the definition of menopause in the field of medicine is when periods stop for 12 months. So no menses for a year. There's hormonal changes we see on labs that occur to drive that process. And then that is the definition of someone being what we call postmenopause. Some common symptoms associated with menopause are things like hot flashes, often intense, insomnia. Sometimes that's related to those fluctuations in body temperature. Sometimes the insomnia can be related to mood changes. Things like anxiety and irritability are really common during the transition of menopause. Also things like vaginal dryness, pain with sexual activity, any of the tissues in the body that are have receptors for hormones. So things like the uterus, breast tissue, bladder, all of those body systems can present symptoms when we're going through a hormone change. Interestingly, Western societies have, so we're talking about the USA and North America, have a high prevalence of menopause-related symptoms, which is not necessarily a requirement, and we don't always see that in other places of the world. So part of it is, we'll talk about tonight is what are the lifestyle practices? What is our environment? What is happening in this commonly fast-paced society that is potentially aggravating those symptoms? And an interesting statistic is that in about 80% of women, hot flashes usually will last at most 10 years by the end of that cycling so menstrual periods. And then after that, they will go away on their own without any intervention as the body kind of adjusts and just recalibrates with their cessation.
So I'm going to go through some of the factors that contribute to causing the symptoms that are associated with that menopausal transition. So less active lifestyle is a huge one. Menopausal symptoms at every age are decreased in very physically active women as compared to those who are less active. Chronic stress and adrenal dysfunction. So adrenal glands are our stress response system. They're little glands that sit on top of our kidneys, kind of up against our back, in the back of the body. And they make a number of hormones. They make some of our stress hormones, like cortisol and adrenaline, but they also make small amounts of sex hormones. So in a healthy state, they can actually take over for the ovaries and produce small but sufficient amounts of sex hormones that are enough to reduce or eliminate menopausal symptoms. And then exposure to environmental chemicals can contribute. So many environmental chemicals are endocrine disrupting, meaning they negatively impact our hormone systems. So that includes chemicals like BPA, which most people have heard of at this point, but also includes BPF and BPS, which are the replacements that have been used in products that say that they are marketed as BPA free. So essentially, it's a marketing switcheroo where, everybody or many people have heard that BPA is bad for you and want an alternative. The companies have just swapped out a similar compound that just has less research on it, but is probably seeming to be just as bad. Phthalates are another hormone disrupting chemical or class of chemicals, and those are found in all sorts of plastics, artificial fragrances, pesticides, flame retardants, and more. And then oxidative stress from exposure to these chemicals impairs ovulation and can actually result in early menopause, among all sorts of other hormone problems, such as infertility, painful periods, and endometriosis. So of note, our hunter-gatherer ancestors, and there are still hunter-gatherers living their ancestral ways today, very, very likely suffered or suffer minimal or no menopausal symptoms, in part due to their very active lifestyles, much lower exposure to both chronic stress and environmental chemicals. So that's getting back to, menopause does not have to equal all of these uncomfortable symptoms. It can be this much gentler transition, from cycling to not cycling, but not medicalized, symptom-ridden time. Low estrogen levels in menopause result in the acceleration of osteoporosis, a loss of bone density, cardiovascular disease, and cognitive decline. And actually, more intense hot flashes may be an indicator of cardiovascular disease. Any questions so far? Pass it back to Dr. Dowdy.
Great. So let's talk a little bit more about physical activity and what the research is saying. So there are lifestyle factors to reduce specifically hot flash severity, since that is the most common symptom that women go through. And there are studies showing that 45 minutes of moderate intensity exercise, so those are things like cycling, jogging, hiking, where you're sweating and you have your heart rate up 4 to 5 times a week, can reduce hot flash frequency by 60%. So that's pretty significant. There are other lifestyle factors that reduce overall oxidative stress and the body's overall ability to metabolize hormones. So things like alcohol. Red wine is a very common trigger for hot flash frequency and intensity. Red wine or alcohol in general, and then especially red wine, or alcohol in general and red wine, are just, again, oxidative stress on the body. Sugar, so the more refined and the more grams of sugar in the diet will aggravate severity. Red meat and spicy foods are the other things.
And then
And
sometimes just like individual food intolerances as well.
absolutely. Yeah. I think just adding to the body burden of inflammation, and again, just potentially slowing down all of our basic internal organs of detoxification and how we clear hormones.
Mhm.
So there are some things, some herbs, some botanicals that can help support reducing hot flash severity, as well as just some of the other symptoms, the mood, maybe even the irregular menses that are occurring up to the cessation of them, so that perimenopausal period. And those are things like black cohosh is an example, and maca root. Maca is a Peruvian root that there are many, many, many different what are called phenotypes. And depending on which phenotype someone is using, it can help support, fertility in a premenopausal woman. And then we have perimenopausal transition. Vitex, excuse me, Vitex is the botanical Latin name for chase tree berry, if anyone's heard of that. Chase tree berry is supporting progesterone levels in the body. And a lot of the time in the transition through menopause, it is the imbalance in the estrogen to progesterone ratio that is driving the symptomatology, and especially hot flashes in particular. So it's when the hormones all just don't decline in this perfectly parallel equal level 1-to-1 ratio. So a lot of time it's a dominance or a deficient state that is driving a symptom. So we can support that with Vitex, red clover and dong quai are other examples. Wild yam is also another source of bioidentical progesterone coming from a plant, coming from a tuber. And then there's also isoflavones and other plant estrogen compounds that we group into the category as phytoestrogens. So there's definitely lots of options out there, and Dr. Wood and I are frequently guiding patients on what is going to be best for them, because not everybody experiences all of the symptoms we mentioned earlier in menopause, and yeah, they'll need an individualized treatment option.
And I just want to say organic, traditionally produced soy foods are a source of plant estrogens that can actually ease symptoms. I wouldn't recommend, super highly processed, like soy curls or things like that are not made in a traditional manner and not fermented. That's not going to be so good. But organic tempeh, organic tofu, a couple times a week can actually be really beneficial. Those are phytoestrogens or plant estrogens that we can get from our food. And then I just posted a link to our product collection. So we don't carry all of these herbs, but we carry some of them, as well as some of the other kind of mood support things that Dr. Dowdy's going to mention. So if you want to take a look at what we're talking about, that link is in the chat now.
Thank you.
Mm-hmm.
So mood, there is mood changes, again, hormonally driven. Some women might experience anxiety, others depression. Sometimes when estrogen is decreasing, but testosterone is still present or actually a little bit elevated, women will experience rage and anger. It's a common emotion. Um, so things like theanine, L-theanine is an amino acid that's very calming to the mind and the brain. It can be helpful for anxiety. There's also a nutraceutical, an amino acid called 5-HTP, 5-hydroxytryptophan. 5-HTP is a precursor to producing serotonin, which is one of our neurotransmitters that help with mood stabilization and is a natural antidepressant. It is important to note if anyone is taking an SSRI, so a serotonin reuptake inhibitor antidepressant, you would want some guidance from your physician or one of us on adding 5-HTP into a protocol. And then adrenal support, right? We mentioned that those glands will can be sufficient and will produce some of the sex steroids. So if the adrenal glands need some nourishing, botanicals like ashwagandha are very tonifying and balancing. They lessen the effect of cortisol on the tissues. And then rhodiola is another great example of adrenal support through that time. Oh,
All
yeah.
right, so who is hormone replacement therapy appropriate for? And we're going to touch on safety as well. So in conventional medicine, generally synthetic hormones are what's offered for hormone replacement therapy. Those can be referred to as Premarin, as is the synthetic estrogen, and then progestins or medroxyprogesterone as the name of the synthetic progesterone. Um, and a study done by the World Health Organization in 2002 gave hormone replacement therapy a bad rap. The study was actually stopped early due to increased breast cancer risk and increased cardiovascular disease risk. In 2022, a meta-analysis looked at that study and found a lot of flaws. And over a decades of study, it has been found that these synthetic forms of hormones increase risk of heart disease and breast, uterine, and ovarian cancer. So, they are still offered to some degree in conventional medicine with, a warning of do not take any more than 10 years. Definitely not if you have any risk factors for breast, uterine, ovarian cancer. But also a lot of women who do have tried them in the past, on average, many, many women stop them within a year due to side effects. So those risks, the heart disease and cancer risks, were initially also attributed to bioidentical hormone replacement therapy. But over the past 10 or 15 years, there have been numerous studies looking at the bioidentical hormones, the ones that are exactly the same as what our bodies produce, whereas these synthetic ones are similar but not the same. So a lot of studies in the past 10 to 15 years have looked at the bioidentical forms and found that they actually do not carry the same risks and, in fact, have some protective factors. So, for example, natural bioidentical progesterone has been studied and shown to result in decreased risk of breast cancer, whereas the synthetic progestin form increases breast cancer risk by 40 to 69%. So huge difference. The synthetic hormones actually kind of waste our body's metabolic energy by giving incomplete messages to our cells, which then fail to produce a balanced hormonal response. And they're associated, because of this, really, they're associated with a worse side effect profile. So the standard of care in medicine recommends hormone replacement therapy for hot flashes, which 85% of women experience those at some point, mood disorders like depression and anxiety, coming on in menopause or in perimenopause, sleep disturbance, which often in this transition is a product of progesterone deficiency, frequent waking and having a hard time getting back to sleep. Joint aches and pains, and we actually have that can be due to a lack of estrogen. And then hormone replacement therapy can be used for vulvovaginal symptoms like vaginal dryness, vaginal pain, frequent urinary tract infections, increased urine frequency, and incontinence, so losing urine with coughing, sneezing, laughing, bearing down, etc. So our pelvic floor muscles have estrogen receptors. So those are what kind of hold the urethra closed unless we are trying to urinate and affect the bladder. And so, when our hormones are going up and down a lot in transition and then ultimately declining, those areas get really impacted. And then hormone replacement therapy can be really helpful for cognition, memory, and then, as I mentioned, bone density, supporting bone density, which it's a huge issue. There are such high rates of osteoporosis, and this is one of the absolute best ways to maintain bone density. And then cardiovascular disease prevention. And with the bioidentical hormones, you don't have to stop after 10 years because they don't carry the same risks. And in fact, starting hormones earlier after menopause is associated with risk reduction of all-cause mortality, so death from any cause, and with specifically cardiac or heart-related mortality. This same benefit wasn't found for those who started hormone replacement therapy years after menopause. So starting it, during the transition actually has greater protective effects.
Yeah, that's super awesome. We're living longer. We are out, I'll have this conversation with patients. We are outliving our hormones. This wasn't the case when we look back at how long have humans been living and cycling. Lifespan was 40 or 50 years not that long ago. Now women are living into their 80s, 90s, potentially. So we now are understanding that those hormones have other impacts in the body outside of the bikini parts, right? There are estrogen receptors in the brain. There's now research on cognitive decline, Alzheimer risk, and the lack of estrogen that's happening in those later years because we're living longer. So it's fascinating. Um, but hormone restoration, intervention or treatment, even with bioidenticals, isn't for everybody. It's important to understand what the risks and where to proceed with caution, right? So there is no like hard line of absolutely not for you, but it does merit a discussion if there is a history of any type of hormone sensitive cancer. So that would be ovarian cancer or endometrial. So that's a uterine type of cancer, bowel cancer, some melanomas, which is a type of skin cancer, actually have a hormone connection, and then even benign breast disease. So, and carriers of the BRCA gene mutation for breast cancer. So, those are some of the cautions with that class of chronic disease. And then other things to consider would be vasculature conditions, so varicose veins, having a history of blood clots or some type of clotting disorder. And then there is a potential association with a condition called endometriosis, which is an estrogen-driven, estrogen-responsive condition that women experience premenopausal, so in their 20s to 40s. But if that is in someone's history, it's important to take that into consideration. So when offering or considering taking bioidentical estrogen. So the biggest take home is just like understanding what is your individual, risk, if any, and then what the benefits would be and if there's any modification. So what we do know from the research on the bioidentical hormones is that the delivery method, there's a lot of nuance that will drive a potential risk. So that there is a difference between a topical estrogen patch and a vaginal or urethra applied estrogen cream. There are also different types of estrogen that we can have a prescription made and compounded to support exactly what that particular patient needs. So yeah, so the take home really is that hormones don't cause cancers, but some of the synthetic ones, as Dr. Wood was mentioning, can increase the risk of cancer. So if it's a hormone sensitive one.
All right. So some things that increase cardiovascular disease risk, having to do with our hormones include going through menopause early. So having that drop in hormones on the earlier end. Some women, it is considered within normal to start the menopausal transition or even be fully through it by age 40, although that would be on the early end. Some women will occasionally go through menopause even earlier than that, like 35, between 35 and 40. So losing those hormones that much earlier, like, 5-10 years earlier than average, puts women at increased cardiovascular disease risk. Having short menses can be a sign of hormone imbalance. So this is, before menopause, but having a period that's 3 days or fewer can also be associated with increased cardiovascular disease risk, as well as fewer pregnancies or not having any pregnancies. Smoking increases heart disease risk, sedentary lifestyle, and then highly processed foods. Research shows that women with severe hot flash symptoms have higher cardiovascular disease risk, and then elevated LDL and ApoB, which are types of fats and proteins found in our cholesterol levels, that can be tested on lab tests.
The other thing I was going to mention too, Dr. Wood, is surgical menopause. So that is an
Oh,
example of
yes,
early menopause. We've seen
absolutely.
women in the office who've had a hysterectomy in their 20s, and no one ever offered them any hormone support until now.
Yeah,
We're having this conversation at 50, and there's 3 decades that have gone by.
absolutely.
Yeah.
Yeah, that should be handled immediately if a woman needs to have her ovaries removed or her, the ovaries will keep cycling without the uterus in women who don't have a complete hysterectomy, meaning, ovaries also removed, but often it can decline. So definitely worth testing in those cases. And really, every person in that case should be offered hormones for quality of life, and then also all of this reducing risk. So estrogen is most effective for the hot flash symptoms, the bladder symptoms, and preventing bone loss. But actually, progesterone and testosterone help to build bone as well. Osteoporosis is really, really common. So 1 in 10 women over 60 will have osteoporosis, and then 1 in 2 postmenopausal women will have osteoporosis in their lifetime. And estrogen replacement is the best way to treat osteoporosis. It really reduces fracture risk greatly. I'm seeing a question, does tubal ligation have any effect? No, that would not have the same effect. So we've got some different delivery forms for the different types of hormones. Estrogen can be given in an oral pill, but that actually does, that has more heart disease risk than topical or pellet therapy. And we'll go into the pellet form a bit later. So for estrogen, I think both of us mostly use a patch or a cream or a pellet rather than taking a pill. If I will occasionally use an estrogen pill if there are no other risk factors, and that's just like the only way that the person will take it. But I kind of prefer the other forms. And then progesterone can be given in a capsule or an oil that's taken orally for better absorption through the mucosa of the mouth, or a troche, which is like a little dissolvable tablet that dissolves well and absorbs well through the blood vessels under the tongue and through the oral mucosa. Or it can be given as a topical cream. Testosterone can be given as a cream or in a pellet form, which is actually like inserted into the skin to dissolve slowly in the skin. So those are kind of the options that are out there. And as we touched on, like, we won't get into the nitty gritty, but because that's an individual conversation with each person, but just to give a couple examples of why it matters which form you choose. Someone with known cardiovascular disease history would do much better doing a topical estrogen as opposed to an oral form. Someone with osteoporosis would actually maybe benefit a bit more from an oral form of estrogen versus topical. However, you still can get benefit from like a patch. There are studies that show that works okay. There aren't too many studies looking at oral progesterone, but it does, there are some that suggest that if you're taking estrogen, taking oral progesterone works better for reducing risk of breast cancer than using topical progesterone. So there are just some details there that are useful to talk through with your doctor, or talk through with one of us. And Women who've gone through menopause and still have their uterus, they have not had a hysterectomy, always need to be taking progesterone with the estrogen because that really protects the uterus lining from hyperplasia overgrowth, which can turn into uterine cancer. Oral progesterone is much better for sleep. So the sublingual dissolvable form or the oil works the very best for absorbing more locally, like in the mouth and crossing the blood-brain barrier, where it affects some of our neurotransmitter receptors that deepen sleep and help calm, help reduce anxiety, help with calming, much more restful sleep. And oh, I already said that. And compounding pharmacies can really make some wonderful kind of detailed products that suit the individual. So you can actually have a compounded capsule of progesterone that's time released. So it slowly releases throughout the night to really help sustain deep sleep.
I got to unmute. Thanks.
Oh.
So we wanted to take a minute and talk a little bit about testosterone. Testosterone isn't just a hormone for males to supplement through when they go through andropause. Women and females can actually experience a decline in testosterone. Commonly, it remains optimal throughout their life and can actually stay elevated. And then as the estrogen's declining, some of those mood, agitation, anger, rage symptoms can develop. But testosterone is actually really important for libido, arousal, just energy and stamina throughout the day, maintaining lean muscle mass, and then mood support. And there is a lot of research supporting optimal testosterone levels and their association with lowering somebody's cardiovascular disease risk. And nowadays, there are so many really great delivery methods of testosterone that don't involve long needles going into the gluteal muscle on a regular basis. There are topical topical delivery methods. And one of the options we do at the Tummy Temple is a pellet delivery. So pelleted hormones, if you've heard about that in the community, are just granulated hormones. So like powdered sugar in a hormone that is able to be put into the fatty layer of the hip in a very minimally invasive and easily tolerated procedure. And then our bodies just are able to pull what they need from day to day from that hormone reserve. So, and we know that in women who use that delivery method, they tend to have the benefit of the effect for about 3 to 4 months, which is really awesome. So yeah, and the other hormone that is able to be used in that delivery method is the estradiol. So estrogen can also be a pelleted procedure, and not progesterone, due to its great job at helping someone sleep. And we wouldn't want that hormone to be circulating all of the time at a peak level because it can cause like a drowsiness, or somnolence is the medical term for that. So yeah, the pellet delivery is very convenient and close to, physiologically what your body needs.
Oh, I was muted again. Better absorption as well, right?
Oh yeah. Yes, exactly.
We've
Yep.
heard back from some of the people who have done the pellet procedure who used topical hormones for years and got some benefit, but kind of realized through switching to a pellet that they weren't getting the full benefit of the hormones, and just feel fantastic with the pellet because the hormones get into the system and are absorbed really efficiently. So that's a nice benefit as well. There's a couple questions. So one person says, I've tried estrogen patch 2 times and it caused really bad acne after 4 weeks. The oral progesterone caused bad headaches. Do you think I just need a different combo? Yeah, I mean, they might have been too high of a dose for you. The estrogen patch is just estradiol, and there we have, our bodies naturally make 3 different types of estrogen. One of them is associated with more disease risk, and so we don't ever use that in a supplement. But the other 2, there's the one that's in the patch, and then there's another one that's weaker, but has really good beneficial effects. And so, in a compounding form, we often use 80% of the weaker one and 20% of the one that you got in the patch. And so that could be a really nice option. And then, yeah, maybe topical progesterone would be better for you and just a lower dose. So, anything to add on that, Dr. Dowdy?
No, I don't think so. No. One of the things that Dr. Wood was going to share about next was just testing. So we do a lot of testing, different types, to kind of assess where someone's at when coming up with a treatment plan. So frequently patients come in on previous hormone prescriptions, doses, delivery methods, and they have their hormone levels or metabolites haven't been checked. So we'll often check that to compare it along with what we're hearing from their symptomatology. So yeah,
Absolutely. That's a
yeah,
great strategy as well. Yes.
yeah. Yeah.
And then someone asks, are compounded bioidentical hormones typically covered by insurance? The compounding pharmacies will give you a form that you can submit to your insurance, and sometimes insurance will cover some or all. You can actually get, so the patch that was mentioned, and then the oral capsule of progesterone can be, those are made by a standard pharmacy, or I mean, standard like drug company, and those usually are covered by insurance. So, that would be kind of the lowest cost, like most, pretty much assuredly covered by insurance form. The compounded ones, it depends on your insurance. Probably the fancier insurance plans might reimburse part or all of that, but hard to say. You'd have to call them and ask.
Most of the pharmacies local to our area have really competitive pricing. Like this is an astronomical thousands of dollars a month for these prescriptions.
A lot of
And
times it's like around, I mean, usually with compounded hormones, it's cheaper to buy more at once. So usually, oftentimes it'll be a 3-month supply. And I often find it's like 30 a month, but that, that'll vary based on the prescription. But yeah, not outrageous.
yeah.
All right. Let's see. Do you want to take this
Sure.
one?
And then there's another question. I guess I'll just read them out loud. Someone who's 51 and taking tamoxifen to reduce chance of breast cancer recurrence from 5 to 3%. How can we support hormone balance as well on this drug? Goodness, there are absolutely some things you don't want to combine with tamoxifen, but there are options to help support. And don't forget about like just detox and the adrenal glands. So come talk to one of us, and we can absolutely provide you some specific guidance. And we have references and databases that look at drug, herbs, drug nutraceutical interactions, so that you're getting a safe recommendation. But yes, there are absolutely things to help.
Yeah. Let's see, recommendations or resources for supporting hormone health with food choices. Well, I mentioned the organic, traditionally made soy foods are a source of phytoestrogens or
Phytoestrogen.
plant estrogens. I guess I would just say, eating a whole food plant-based diet is going to be so helpful for all sorts of factors of hormone balance. So, eating fiber-rich foods like ground flaxseed, chia seeds, apples, pears, blackberries, garlic, onions, all of those foods help us to detox both excess hormones that we don't need anymore, and that would be that our bodies are making naturally while cycling, or the ones that, that are being taken as a treatment. So we want to use the hormones, and then we want our bodies to get rid of them when we're done with them. So we're not like having too much kind of accumulate, swimming around, causing problems. And so dietary fiber helps with that. And brassica family foods like broccoli, cauliflower, cabbage foods, and all of the foods in that family have great benefit with detoxing excess estrogens and helping us metabolize estrogens into the less harmful forms to reduce disease risk. Other thoughts, Dr. Dowdy?
I think just supporting internal organs of detoxification. So the liver, any foods that help the
Absolutely.
liver, beets, castor oil packs topically to the liver, coming in for colonics. Colon hydrotherapy is not just emptying out the colon and like stool waste, but liver support, bile secretion, just, yeah, clearing metabolites. So
Burdock root is great for the liver, and I know the co-op sells that frequently. Garlic and onions are great for the liver. Lemon is great for the liver. Yes. Tummy Temple, we are not in network with medical insurance. We offer a super bill receipt that can be submitted to insurance. So a lot of private insurances will reimburse. Oftentimes it depends on the plan, but 50 to 80% for our visits. And then the
patients can use,
treatments.
oh, I was going to
Sorry,
say,
go
I
ahead.
was just saying, I always remind patients sometimes they don't realize they can use their flex savings account or their health savings
Absolutely.
account that they might have through their employer that they personally set up. They can use that for at the pharmacy for hormones. They can use that for office visits. Yeah.
Right. And then, yes, even though we're not in network with insurance, if we send in a prescription, that often is covered by insurance. That we talked about how the compounded medications might be a bit different, but the ones to a standard pharmacy, there's no difference in insurance coverage if we send it in versus an MD, for example. All right. And then Dr. Dowdy touched on the testing a bit. And so I'll just say another thing or two about that. We can do, so for like checking levels of hormones, we can do blood testing or saliva testing. If someone is clearly through menopause, we know their estrogen and progesterone are going to be low. We're not 100% sure about testosterone. I think what was it? Only 25% of women actually have reduced testosterone, have testosterone decline after menopause. In 50%, it just stays steady throughout life. And then in 25%, it can actually be elevated even after menopause. So that one can be actually really useful to test. If we're not sure if you're through menopause, we can test a couple tests called FSH and LH that are hormones coming from the brain talking to the ovaries, and those will go kind of sky high once you're fully through menopause. And so that, if someone has had a hysterectomy and isn't having periods, where we can count, 12 months out from the last period, that can be a useful clue. And then we also can do urine hormone metabolite testing, and that can help assess risk. Because as we talked about, there are different types of estrogens and they break down to different metabolites or breakdown products, some of which are more protective against cancer and some of which have higher risk associated with them. And so that urine metabolite testing can help tease that apart, which, in people that might have a bit more complicated medical history or aren't sure, sometimes that can be really useful. And then we can actually use some herbs and nutrients to help modulate that to reduce risk. So that can be a helpful thing to do. And our genetics and our diet determine how our bodies break down hormones and when we're through with them. And so, we can tend to break estrogens down in a way that's more protective or carries higher risk. So it's useful to understand that. And then I've run into this a number of times. A lot of conventional doctors don't offer testing for hormones, just say it's not, it's not what we do, it's not useful. We find that it is very useful in a lot of cases. As I was saying, not every woman who's fully through menopause needs testing, because we can assume the levels will be low, but there are a lot of cases where it's really useful. I think we got some more questions. Do you want to take one of those? Let's see. Oh, you're muted.
But I unmute. I'm sorry. As there was a question on how to connect with us. If you're interested in learning more about us and scheduling an appointment. And I just put our website, which is tummytemple.com, and then our front desk scheduling number for anyone who has any questions. And then there was a question on how do we know if we're postmenopausal? Well, in a woman who has an intact uterus, the cessation, so meaning the ending of menstrual cycles or periods for 12 full months, is the medically considered postmenopausal. If someone has had a hysterectomy and they aren't sure because they don't have that cycle to track on the calendar, there are two hormones Dr. Wood mentioned, FSH and LH, that we can test in the serum, so in the blood. And depending on where those can define, yes, you are postmenopausal. So.
And then I see a question a little further up. I just had a hysterectomy 3 weeks ago. How soon should I or would I be able to get started on hormone replacement therapy?
I think it depends. Well, it depends on your age too, would be part of it. And we would probably order some serum hormones to see what
right. Assuming that the ovaries were removed. If the ovaries are still intact and just the uterus was removed, you may not need hormones. If the ovaries were removed, testing might be indicated, but you would be able to start hormones now. That would be fine. Yeah. And let's see, are there ways to reduce testosterone in people with high levels? Absolutely. There are a lot of things that can help with that.
Yeah, I'm just thinking of there's examples of botanicals that can help.
Yes.
Menopausal is an example of, there are lots of different nutraceuticals out there to help with that. Yeah. And then, oftentimes elevated testosterone, in someone who's premenopausal can go with, correlate with PCOS syndrome. And that's often a premenopausal condition.
Oh, sorry.
Yeah.
Stands for polycystic ovarian syndrome. And often associated with high blood sugar, and, managing the metabolic issue is part of reducing the testosterone and balancing things out. And then, one herb that helps lower testosterone is saw palmetto. And there are others as well. So yes. But that would probably want that to be part of a whole plan, not a one-off herb, because it can be a more complicated thing. And there are medications that can block testosterone as well. And so those can be part of the discussion if needed. Absolutely. So just want to wrap up and say thank you so much again to the Olympia Co-op. This is something we're passionate about, and we're so happy to share it with you, and hope you learned something and hope this was useful to you. And we do want to offer a couple discounts if you're interested in trying the things that we talked about today. There is we're going to offer a discount code for products in our online store for orders placed in the next week. And I'm going to send out a follow-up email. I'll probably get that out in a couple days. I might not be able to do that immediately. That'll be the only email you get from us unless you want to sign up for our mailing list, which we do send out really useful information on there. So please do if you're interested. But otherwise, you'll just get this one email from us. That'll be a wrap up from today. It'll have that discount code for our online store. And then also, if you wanted to come in for a visit, we're offering $20 off any 1 hour visit. So that could be a consult visit, a colonic, a lymphatic therapy, craniosacral, and you'd have to book it in the next week, but it doesn't have to actually be scheduled for the next week. You just have to call in to make the appointment in that time. So we'd love to see you if you want to check out some of our offerings. And thank you so much for being here. We love sharing this information.
Yeah, thank you, everyone. Great to meet you all.
Thank you so much, you two,
Great night.
for sharing with us your prodigious information. Super helpful.
Our pleasure. Thanks again
All
for
right, until
hosting.
next time.
Yep.
And we'll get out the link to the recording in case you forgot anything. We'll send that via the email.
Right, absolutely. Yeah. So keep an eye out for that in the next couple days.
Thanks so much.
All right. Have a good
Have a
night.
great night.